Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I help you feel, look, and perform your best regardless of age or injury. I hope wherever you are, I hope you're having a great St. Patrick's Day. I am not wearing green, but I'm about to go to the gym, and then after that I'll put green on. I'm actually wearing, I don't know if you can actually see this, turn this way. I just finished the 75 hard program yesterday, got through all 75 days and did not fail, did not have to start over. For those of you not familiar with that, that is 2 45-minute workouts a day, at least 3 to 4 hours apart, one of which has to be outdoors. And that's every day, no matter the rain, cold, whatever. That's following a diet with no cheat days or no alcohol. That is 10 pages of reading of personal development every day, not audiobooks, has to be a book, a self-portrait every day, and there's one other that I am not, and a gallon of water every day, which was the hardest part for me. And I just finished that yesterday. So I'm very excited, and I feel like one of the few times that I actually brag about it, and there's no question that's a brag, by wearing the sweatshirt. I felt like doing that. So no scrub top today, no sweater or fancy, nice clothes. This is casual today. But I hope you're having a great St. Patrick's Day. As always, please remember, yes, I will answer your orthopedic questions, surgery, recovery, injury, rehab, that kind of thing. Or it could be health and wellness. I am not giving you medical advice. I am not your doctor. You're not my patient. If you want more information about how to become a patient of mine, more information about that, it's in the description below, and I'll talk about that at the end. Having said that, I haven't seen you, examined you, looked at x-rays, any of that. I can't give you medical advice. That's not legal in this country to give people advice in places, online, phone, video conference, in places where you as the person, if you're in California, if you're in Washington State, I don't have medical licenses there, so I cannot give you medical advice. Nobody can. Every now and then I get somebody that comments and they're frustrated I'm not giving them medical advice. That's not allowed. I don't know where you are. Maybe it is, but it is not allowed here. But I do give you information that hopefully will help you make the best decision for you. Maybe you now understand what that injury is, or treatment options for that injury and possible surgery, so you can take that to your doctor, take that to your orthopedic surgeon, and say, hey, what about this? Or, maybe you can better understand what that doctor told you, because let's face it, I have done this long enough to know and get a huge percentage of patients that are second opinions that a whole lot of orthopedic surgeons cannot speak in real English. Layman's terms, and they use all sorts of fancy terms. Literally, a friend of mine yesterday had no idea what her doctor said, and he spent almost an hour with her, which is another issue because you don't usually get anywhere near that period of time. So, having said that, I hope that this can be helpful, and we'll start at the top. Jamie, who I see on here frequently, and I appreciate that, Jamie. If I can get your question to appear on the screen. I don't know why I've had trouble with this lately. Otherwise, I'll just read it. There we are. I am doing well, thank you. Had surgery on my right shoulder, found out I tore a ligament in my shoulder. That's no fun. I used to love those surgeries. Yeah, I've talked about that before. I've gotten away from doing surgery as I focus more on what I call anti-aging orthopedics and helping people avoid surgery. But that was one of my favorite surgeries. Labral repair, capsulolabral reconstructions for dislocations, things like that. Really, really enjoyed it. What can I do for the stitches? They're driving me crazy. I can't itch them because I'm in a sling. Monday will be 2 weeks post-op. Okay, a couple things. One, I assume that's arthroscopic, meaning they did 2 or 3 or 4 incisions, looked in with the scope, did all the work, and then you have these little tiny incisions, in which case the stitches would be would be outside of the skin, these nylon stitches that typically come out in 2 weeks. So honestly, if you do nothing, they're probably about to come out. Having said that, now if it's an open surgery where they make a big incision to get down into it directly, a lot of the times those incisions are closed with stitches under the skin, and then there's nothing poking out. But I'm going to go with the working assumption here that it's an arthroscopic surgery with a few little poke holes and nylon stitches outside the skin. Yeah, there aren't really easy ways. Yeah, I very much agree. Try to not scratch them. You don't want to open the wound up at all. you could try, usually it's a matter of keeping it dry, so maybe taking the bandage, if there's a bandage on it, take that off. That's one of the biggest reasons I've seen it itch. Otherwise, it would be more maybe trying a hydrocortisone cream just a little bit to whichever one is itching, or a Benadryl cream, something like that. But typically airing it out is, and some people have told me like taking a hair dryer and blowing hot air on it to dry it out a little bit can help. Typically, again, that goes away. Nylon is actually a very non-inflammatory suture, so typically it's not so much the nylon. I do wonder if it's something more related to the bandage or something like that. Again, it's hard without seeing it, but usually not a bad sign. All right, Shang from Detroit, very cool. 32 ACL partial meniscectomy 10 years ago. That is interesting. X-ray shows slight arthritis, no symptoms yet. Anything I can do other than slow it down? Weightless training and biking. So that's a long, not a long question, but a long answer to that. So first thing to talk about, and this is for everybody, but interesting, Shang gets to demonstrate it. So I always tell people that tear their ACL that you do surgery to stabilize the knee, prevent the tibia from shifting out of place under the femur. There are a lot of people a lot of surgeons even that say, oh, you need to do surgery because you'll get arthritis if you don't. You're very likely to get arthritis even if you do have surgery. Now, the rates of arthritis are lower than if you don't have surgery, but they're still much, much higher than if you had never torn your ACL before. You're very likely going to develop arthritis 10 years after ACL injury and surgery, certainly 15 and 20 years. That's the nature of the tibia shifting out of place and the bones banging against each other on their way out, especially if that happened multiple times before the injury was fixed surgically. So we do know that happens. That's how it goes. Now, yes, the question goes to how to prevent it. I've never been a big believer, so I'm a big fan of exercise, and there's not a ton of great evidence that running or other impact activities are necessarily causing harm. There's some argument actually that running and walking may actually be beneficial for cartilage. So I don't usually shut people down from that. If they're symptomatic and having a lot of pain with running, maybe you still let them run, but you modify that, fewer days a week, things like that. But sure, cycling, swimming, there's lots of non-impact activities if those are certainly easier as well. I feel that the big factors involved in, this gets to, again, a little bit of what I do is using experimental or what are considered off-label treatments that are approved by the FDA for something else, but maybe not for arthritis. So I think it involves things like stopping the damage, medications potentially, and this is not medical advice, but medications like penisin polysulfate, melatonin, high-dose melatonin, not the sleep supplement melatonin, metformin, rapamycin, things like that, and trying to rebuild the cartilage, and that would be potentially injections like PRP, injections like exosomes, things like that. Potentially adding BPC 157 as an injection to the knee, even though I'm not confident how much that actually rebuilds cartilage, but those are the sort of the things you at least think about. There's a much bigger answer, and as I've said multiple times in multiple videos, any one treatment probably doesn't make that big of a difference. Probably helps a little bit, certainly more than cortisone, which is definitely going to be harmful, and some of the things that are currently available, but typically it's approaching arthritis from all angles with lots of different treatments can be most effective. So long answer to that. That would be a long discussion in my office. And yes, Jamie says happy St. Patrick's Day. I know I didn't wear green, but I will be soon. Happy St. Patrick's Day to all of you Irish or Irish fans. I hope you're great. See, I just did that one. How do you produce pro-inflammatory cytokines or how do we prevent chronic production of pro-inflammatory cytokines? So part of that is it's out of your control. And I don't know exactly where I got this number. I'm sure from research somewhere, but about 3/4 of people have a naturally pro-inflammatory state in their body. Obesity, eating not really great foods, lots of processed foods and just junk foods. It is chronic stress. There's lots of reasons people have that. Prior injuries, and for those people, you get those situations where you have this abundance of pro-inflammatory cytokines and degradative enzymes. That's interleukin-1 beta, interleukin-6, tumor necrosis factor alpha, MMP3, MMP13, matrix metalloprotease. Those all degrade cartilage and bone, leading to arthritis. So yes, it can be very important to stop it. We think, based on studies that are out there, that the anti-inflammatory medications like ibuprofen and naproxen, yes, they can temporarily stop the pro-inflammatory cytokines, but they also stop the helpful anti-inflammatory cytokines, the interleukin 10, interleukin 4, so that's not necessarily a good thing. Plus, those medications have a lot of systemic effects that are not terribly good either. Increasing permeability in the gut, which causes a significant increase throughout your body. Gut issues are another common cause of a pro-inflammatory state. So yeah, you're talking about the things that I was just talking about with Shang, things like penisin polysulfate and some of the other medications that are thought to be beneficial in stopping some of those pro-inflammatory cytokines. There's other supplements that potentially can do it too. Again, not medical advice. So, and again, a lot of those medications are experimental or used off-label. So your traditional orthopedic surgeon or primary care doctor is not going to be able to give those to you. But having said that, that's kind of where you start. Jagadish, who I usually see on here, even though you usually have a picture, I can't get your thing to, anyway, I'm good. And Jamie says she got 4 cuts. That makes me think it's the arthroscopic version. How long would it take to heal surgical wounds? 2 months, having trouble around wounds. I don't know. That would be worth asking a doctor why you're not healing it. Typically, skin heals very well. If it's not, you wonder that there's something underneath the skin that's problematic, infection or something else. I don't know that there's an easy answer to that, because skin incisions, even big long ones, the skin itself typically heals 2, maybe 3 weeks at most. So I'm not 100% sure. Glucosamine and chondroitin slow arthritis down. That's interesting in that probably not. The studies have shown not much benefit in terms of arthritis, in terms of changing the course of arthritis. If you look at the randomized control studies on how effective it is for arthritis pain, those were not terribly helpful or beneficial either. But I will tell you, as an orthopedic surgeon that gets a ton of people that say I take glucosamine and chondroitin, a significant percentage of people say that it helps. In my experience, the ones that it helped typically have to take it for about 2 months, and it's fairly expensive. Having said that, there's no real downside to glucosamine and chondroitin, so if you're, hey, try it, and if it feels a little bit better, fantastic. I'm all for it. Having said that, again, it does not seem to reverse cartilage damage at all, but again, have no real issue with it. Why are you in a sling, 4 to 6 weeks in a sling? It depends on the type of surgery, but typically you're trying to allow, in the case of a shoulder surgery, trying to allow whatever was repaired to heal without stress that would pull the stitches apart or pull them out of the anchors or pull the anchors out of bone. It's sort of walking a tightrope. You don't want to keep somebody immobilized so long to protect that repair so long that then they get really stiff to the point you can't stretch it back out, but you don't want to start working on the motion too early and too aggressively and then stretch out the repair. So that's where that comes from. Typically rotator cuff, at least the way I did it, 4 weeks in a sling. With labral repairs, typically 4 weeks in a sling. I would have them come out a couple times a day to do some passive exercises down at their side to just sort of get it moving a little bit. But typically it's pretty strict immobilization because you don't want to reverse all the benefits that you did in surgery. All right, Adam, hyperextended knee, haven't seen doctor, can straighten my leg, can't fully bend it yet. Should I worry about it? Again, I can't examine you, so I can't tell you what you should and shouldn't worry about. Typically, if you can't get it all the way straight, that makes me a little more nervous than being able to bend it all the way. But that doesn't mean that there couldn't be structural damage. Significant amount of swelling right after an injury would worry me. Inability to get the knee all the way straight would worry me. the knee getting stuck in a certain position, or it is stuck, meaning it's bent at maybe 30 degrees. You can't get it all the way straight. You can't bend it. It's locked in a certain position. That would worry me. Or feeling like your knee's giving out on you. That would worry me of the things that, hey, there is very likely structural damage and I need to get this checked out, probably get an MRI to find out what's going on. Those would be the things that would worry me. Okay, I think I got everybody's. I really appreciate it. I'm going to head over to Instagram here in a few minutes, but I very much appreciate it. If you'd like to come see me as a patient, you can get the information below. We're looking for 5 patients specifically with knee pain, but it could potentially be another joint in the body, who are looking to get significantly better in the next 30 days without surgery, without cortisone shots. If you're potentially interested, click the link below. When that takes you to my contact form, put in your name, email address, phone number. Just type the word interested in the description and I will get you more information. So I hope that this was helpful. I hope you have a fantastic rest of your day. I will see you very, very soon in an upcoming Ask Dr. Geier Live. Take care.